Hi, my name is Olivia Gatto, and my presentation is on HIV and AIDS. So what is HIV? HIV is human immunodeficiency virus. It attacks the cells that help the body fight off infection, and it's spread by contact with certain bodily fluids of a person infected, so mostly through unprotected sex or sharing of drug equipment. There's also no cure, so it's one of those diseases where if you contract it, you're going to be treated and dealing with it for life. If it is untreated, it can actually progress into AIDS. So there's a common misconception about whether HIV and AIDS are the same thing or if they're two separate things. The fact of the matter is HIV is what you contract and AIDS is what HIV progresses into. So AIDS is acquired immunodeficiency syndrome. It's a late stage of HIV infection, and it occurs when the body's immune system is damaged by the virus. So without treatment, your expected survival with AIDS is about 3 years. Unless you're fallen ill with a dangerous sickness, then you're looking at about under a year if untreated. So the pathology, how the virus affects the body. So the CD4 or helper T cells, run through our bloodstream as part of our immune system. And their job is to help fight off infections and foreign pathogens that enter our body from the outside world. HIV virus directly attacks these cells when it's contracted and weakens the immune system and the body's ability to protect itself. So the HIV virus not only attacks these CD4 helper cells or T cells, but they're using them as a host to replicate and create new copies of itself. So when that happens, that CD4 helper or T cell is damaged and it swells and then bursts. So once a good amount of them or enough of them swell and burst, we're looking at an amount to bring your total number in your bloodstream to under 200, then your HIV has progressed into AIDS. So HIV is divided into 3 categories. Acute HIV is when you first contract it, so it's going to be days, weeks, could be early months, symptoms that you're going to get from the contraction, which is going to be flu-like symptoms that occur. Then you move into the chronic HIV, which is a latent or asymptomatic stage. So this period can last months, years, for a long time until you might not even realize that you have anything, because the acute HIV symptoms are so much like the flu or like another virus that you might just think that that's the type of thing that you're fighting off. So the chronic HIV stage is the most dangerous because if you're not aware that you have it, how can you treat it? And if you can't treat it, it can progress into AIDS. So the AIDS is when your CD4 cell count is below 200. And this is when your body is extremely vulnerable to infections. And then you'll start to see a lot of the AIDS-defining conditions as well. So AIDS-defining conditions are a series of things that happen in your body that are telltale signs of AIDS. So candidiasis of the esophagus, bronchi, and trachea, also lungs. So candidiasis is an overgrowth of yeast bacteria, which cause kind of severe infection and rotting of the esophagus, bronchi, trachea, and lungs. You also will see some chronic ulcers, like herpes, and you can see cervical cancer, pneumonia, bronchitis, vision loss. Sometimes you have issues with your liver as well. This is just a short list of some of the things. There are plenty more, but these are just a couple of examples. So a couple of diagrams for you to take a look at. The top left corner is going to be how AIDS is transmitted. There's a couple misconceptions about exactly how it's transmitted. So some people believe that if you drink from the same glass or you kiss somebody who has HIV, then you're going to contract HIV. Technically, this is not true because the transmission of HIV occurs through the transmission of bodily fluids from one person to the next. So we're talking semen, vaginal fluid, blood, things like that. Saliva is not one of those things. So you cannot kiss, or you cannot drink from the same glass as somebody with HIV and get HIV. It doesn't work like that. So it can occur through the use of non-sterile syringes and tools. So if you're using drugs and you have HIV, you have the person who does not have HIV use your needle, they can contract HIV. Pregnancy breastfeeding, if a mom has HIV and then that baby who drinks from the mom will have HIV too. blood transfusion. So some people, if you're getting a blood transfusion and you have HIV, you're taking your blood out and giving it to somebody else. So of course that would be how you can get HIV, if you're taking the blood of somebody who has it. An organ transplant, if the organ donor has HIV, then if the organ donor has HIV, then the organ receiver is going to get HIV if they do not already have it. So it's kind of like a transfer from organ of one person who has it to the next person who does not have it is going to get it. And then you have unprotected sex, which I mentioned before as well. So symptoms of that acute HIV that I mentioned before were fever, chills, headaches, night sweats, sore throat, muscle aches and pains, joint pain, fatigue, swollen lymph nodes, mainly on the neck, and mouth ulcers. The next one on the left-hand corner is going to be a couple blood samples of vials. All the way on the left is before your HIV infection. You can see all of the immune cells intact. The acute HIV infection is when you start to see these symptoms here. That's when you have some of the HIV infection in you, but you're having the symptoms. Then the chronic HIV is your latent or your dormant stage where you don't have any symptoms, and then AIDS is years later when it's progressed. The HIV care continuum on the bottom right-hand side here is from the United States of 2014. It just shows a couple percentages of people living with HIV. So 85% diagnosed, 62% receiving care, and then most important, 49% virally suppressed, which we're going to go over next. So the HIV epidemic began 40 years ago. At the time, it was the leading cause of death in young people. In the mid-1980s, infection rates have declined about 73% since then. 1 in 8 people infected are actually living unaware of their status. Originally thought to affect only man-on-man sex, now we know that it can affect everyone. Throughout the years, HIV has gone from a death sentence to actually a manageable chronic condition. That meant to say condition. So on the right-hand top corner, we have the new HIV infections. So this is just a prediction from the CDC about 2030, hopefully ending the HIV epidemic. You can see there's 38,000 in 2015, and that's just their prediction for the end of the epidemic to happen in 2030. Medical treatment. HIV patients can be treated with antiretroviral drugs, which is a combination of about 3 drugs, to suppress the virus to sometimes lower undetectable levels. This can take about 6 months, and they help prevent the virus from taking over the immune cells. If it's taken correctly, you can bring your viral levels or your viral load all the way down to undetectable, which then means untransmittable. So that's the goal. Should you exercise? You should always exercise the same as if you were HIV negative. There is no difference. There's also no current evidence to say that exercise suppresses the immune system, so people with HIV can perform the same type and amount of physical activity and exercise as people who do not have HIV. Condition of HIV does not affect the body's response to exercise negatively. So the benefits of exercise. The evidence shows the negative implications on metabolism for individuals with HIV. Some of these include increased lipids, central fat accumulation, decreased aerobic capacity. Some medications previously discussed can also have some unhealthy cholesterol level causes, also body fat changes, loss of muscle or bone density, and mental health concerns such as depression and anxiety can also be developed after their diagnosis. So what do we know about exercise? Cardiovascular and strength resistance training combined are known to improve these health conditions, so therefore it's essential that a person managing HIV would participate in physical activity just to improve their quality of life, energy levels, medication effectiveness, their weight management and control, strength and functionality of their cardiovascular system. So I have a case study here. This is Andrea. He is a male, 35 years old, 225 pounds, diagnosed with HIV about 2 years ago. After seeing a physician, he has been prescribed a combination of antiretroviral drugs as treatment. He's been taking these medications as directed for the past year, and he has noticed some changes in his body since taking the medication. Andrea complains of gaining weight, which has never been a concern of his. Currently has a BMI of 27, total cholesterol level of 215 milligrams, and then he's feeling decreased energy levels and lethargy. Otherwise, he has no further significant medical concerns or conditions, and he was very active for most of his life, was an athlete in school, but when he was diagnosed, he struggled a lot with depression. So Andrea is coming to you for help now on how to regain his health and active lifestyle. So my exercise prescription for Andrea would be, first, starting with frequency. I would say 3 to 5 days per week. This is recommended for a normal, healthy adult. And then his intensity, I would recommend low to moderate intensity. Due to his lack of exercise in the past couple years, he should start a little bit lower. It's also proved that extremely strenuous exercise could possibly have an effect on the immune system and increase risk of sickness or injury. Since he's already feeling slightly lethargic, we just want to err on the safe side. And then going to time, I would begin with 10 to 15 minutes per day and increase to 25 to 30 gradually for cardiovascular training. And then 1 to 2 sets of 8 to 10 repetitions per day and gradually increase to 3 sets for strength training. So then the type, I would combine cardiovascular and strength training for him. The combination will increase overall strength and energy levels and burn body fat for Andrea, which are 3 of his most highest concerns. For cardiovascular, I would say walking, jogging, cycling, swimming. Resistance, definitely body weight, definitely free weights, and definitely resistance bands, just to begin to get back in the process. So some precautions: if you have any side effects from the medication that occur during exercise, like dizziness, headache, fatigue, muscle aches, all of the above, you should immediately stop exercise and let your specialist know and just adjust your program if you need to. Also, try not to participate in extremely strenuous intensities, as it can put too much stress on the body. So decrease time and intensity if you feel any pain continuing 2 or more hours after exercise. Some recommendations: sometimes there are days where you feel depressed and tired, and I know this is something that Andrea is going through. So in those times, it should be really important to be active with a family or a friend, because it can help increase motivation and mood. I'd also say begin at a gradual and comfortable intensity for cardiovascular training and gradual comfortable weight for strength training. Try not to hold your breath when lifting as well. This is called the Valsalva maneuver, and it can increase possible feelings of dizziness that you might already have from your medications. I would also say don't be afraid to stop if you don't feel well, or if you change your program with your provider if it's not working for you. We're here for you, so the decision is up to you. Whatever's working for you or not working for you is something that we should know. Lastly, you should have fun with everything you're going through. Exercise should be an activity to release your feelings of stress and anxiety. So you should do more physical activity in ways that make you happy. So those would be the recommendations I have for you. There would be the case study that I have for you, and just a quick description on HIV and AIDS itself. So thank you very much.